This on using the hashtag BBCGMS, he's saying, why do people have to be told what to do by government? If you want to stay safe, then take responsibility for your own actions and think for yourself.
Now it's time for another of our Good Morning Scotland coronavirus diaries, hearing from key workers on the challenges they're facing and the people they're looking after. This morning, an update from one of our previous diaries from Dr. David Chung, who's Vice President of the Royal College for Emergency Medicine in Scotland and an emergency consultant at Crosshouse Hospital in Kilmarnock.
I think lots of people are hoping that we can go back to normal, and that's absolutely obvious, and it's absolutely natural that we don't want to carry on living the rest of our lives with a deadly virus. But I'm going to be a bit controversial and say I, as an emergency medicine consultant, don't want things to go back to normal. And what I mean is that I've seen in the past 3 months totally different ways of working and cooperation and teamwork between people which I hadn't seen before. It wasn't the normal for the preceding years, and I don't want to see that go. And that includes not just my other fellow professionals who are working with a lot more closely, but also patients and the public in Scotland. After an initial dip, where we were genuinely worried not enough people were coming to emergency departments, I was thinking we'd probably just about got the balance right maybe about 2 weeks ago, where we knew from data that most people with a serious problem were coming to an emergency department. They weren't staying at home. But there were lots of people who previously had come to emergency departments across Scotland because it was the most convenient or the easiest option, or they felt another part of the NHS couldn't provide their needs, or there were certain behaviours which were done before which weren't being done, and I'm talking about alcohol, drugs and violence, which completely dropped off. They halved. That part of our work had diminished. So we were doing pretty much what we thought we were really meant to be doing. Unfortunately, this weekend, a combination of good weather and some very mixed messages, to say the least, especially coming from south of the border about the state of play with regards to coronavirus, have led to some big problems. The virus is still with us. It is still a risk to people, especially people with ongoing health problems, people who are shielding, and we still have to do our best to keep them safe and try and be absolutely rigorous in our infection control and keep people separate. But unfortunately, this weekend, because of the sunshine and because of the feeling of some people that it's all over, we have been back to almost normal levels of alcohol-related and drug-related behaviour and violence. And I'm afraid to say that's included, as far as I'm aware, speaking to my colleagues in Scotland, 3 different episodes in 3 different emergency departments where there have been assaults and abusive behaviour on emergency department staff. This is very hard for us to bear. Having worked as hard as we can to try and do our best, knowing that there is a degree of personal risk, to go from claps for carers to spat at, punched, abused and called all sorts of things because some people have decided we're there to pick up the pieces rather than try and behave a bit more responsibly. We need to accept that because of what we're doing with regards to infection control, the fact that people need to put on PPE, the fact that patients can't wait in waiting rooms, the effective capacity of the NHS and social care in Scotland has decreased, and across the UK, in fact worldwide, unless you're lucky in a place where they've got lots and lots of capacity already, like Germany, say, or most of the places in Europe that have more beds, more doctors, more nursing home places than all of us. So we are going to have to continue to be honest with the public and the patients and say, right, we have got a limited service, which means we still need to ask you to work with us. We might work in different ways. You might not be able to just rock up somewhere and get seen. We might have to plan things a bit more. We might have to say there are certain behaviours and things we can't tolerate. But we're in this for the long haul, and we need to accept that, and we will never be going back to normal. But I'm hopeful that we'll be somewhere better by the time we finish this.
That's Dr. David Chung, Vice President of the Royal College of Emergency Medicine in Scotland and an emergency consultant at Crosshouse Hospital in Kilmarnock with his coronavirus diary.